Welcome to the Observe Day podcast, the show where we celebrate the days that matter. From holidays to meaningful observances, we bring you inspiring conversations, stories, and ideas to make each day count. Whether it's raising awareness, learning something new, or simply sparking joy, this is your space to explore the calendar in a whole new way. I'm your host, Wisdom Okonkwo, and I'm excited to share today's observance with you. Let's dive in. This October, as we honor National Depression Education and Awareness Month, we're joined by a guest whose story bridges science, spirituality, and the strength of the human spirit. Dr. Oluwole Babatunde is a physician scientist, psychiatrist, epidemiologist, author, and servant leader whose life's journey embodies faith through adversity. Born and raised in Nigeria, he faced unimaginable loss early on, losing both parents before the age of 13. Yet, through faith and perseverance, he transformed pain into purpose. Today, he serves as chief resident in psychiatry at Prisma Health, South Carolina, where he integrates medical science and faith-based insights to help others heal. His new book, Adapt and Advance, a faith-based step-by-step guide to turning trials into triumphs, offers a powerful roadmap for those struggling with depression, grief, or sensitivity. This episode is about finding light when life feels dark and discovering purpose through pain. Welcome to the podcast, Dr. Oluwole.
Thank you so much, Wisdom. That was wonderful
Yeah.
for the introduction. I'm deeply grateful to be here today, and I hope that we can chat together and hopefully get some information out that will be helpful to our audience.
Yeah. I want us to start from the beginning. You know, you faced tremendous loss early in life. You lost both parents before 13, the age of 13. You lost, I think, your mom 7, and then your dad before the age of 13. How did those experiences shape your understanding of mental health and purpose?
Thank you so much. It was really, a very great thing to go through. For lack of a better word, it was really tough losing my mom at 7. Then maybe I didn't understand how deep what that meant at that time. And, I still had the covering of my dad who was loving and caring up to 13. So things were still fair. But the worst happened, in quotes, at 13 when I now lost my dad. And I was I was left to the whole wide world to try and navigate and find a chat away for myself without both parents. Mental health wise, I would say definitely, like I wrote in a particular chapter in my book, that there were times when I felt really, really sad. Knowing what I know today, I'm sure there were times when I met full criteria for depression, what we would call, major depressive disorder right now. Definitely adjustment disorder with depressed mood. I had, so many other diagnoses, which I would have diagnosed myself if I was seeing somebody who was going through what I was going through at that time. So it was really tough going through all of that and weathering all of that. But looking back now, I'm grateful that at least, irrespective of everything, one has to be able to move forward, adapt and advance and still go forward despite everything that has happened.
A lot of persons, they turn away from faith when they face depression. What made you turn toward it instead of away from it?
That's a wonderful question. For me, faith was ingrained into me first by my parents. They were like both Christians, and by the time I lost both of them, I knew a little bit about prayers. We're a family that always prayed together every night and all of that. So it I was able to turn to God at some occasions. Of course, there were times I questioned God. There were times I wondered if God existed. There were times I wondered if God is good, because if he was good, how will he allow, all of this to happen, to a small boy like me at that time? And I remember the first thing I said after I was told my father died is, why will both of them give birth to us when they know they won't wait and take care of us? So it was really tough. But turning to faith for me was just my default because that was all I knew. And as I kept growing too, it went beyond what I knew alone. As I kept growing, I started developing my own inner self, my own person. And I just realized that faith could be very helpful. Like, for me, hearing stories, and I would, my story, I always say my story will not be complete without mentioning that at some point, I got to read some books of people that have succeeded well in the faith and how they were able to navigate tough seasons and tough challenges. I also read books of people that were not in the faith But the books of those that were in the faith shaped me in a very, very unique way. So I would say one of the things that kept me in the faith, both then and now, is reading stories of people in the faith who have been able to succeed despite very tough situations that they went through in their lives.
Yeah.
So for me, that what made it easy to stay in faith then, and even now for me, is when I read books, when I listen to tapes, listen to messages. In those days, it used to be tapes, cassettes, you know,
Yeah.
where at least nowadays is on
It's just a
YouTube.
fingertip away. Yeah.
Yeah, it's on YouTube
Yeah.
now. So I would say those were the things that kept me grounded in the faith despite what I was going through. I read some of Bishop Oyedepo's book very early, and that was really, really encouraging to me that, considering his humble background then in Nigeria, he could make it to where he was at that time and even now. Beyond him, I've read many other books of people in the faith, even in the US, like Joel Osteen. Joyce Meyer is somebody I follow a lot. Even if, when I was still in Nigeria, I followed her a lot. She went through unimaginable hardships growing up, sure, assault and
Yeah.
trauma, all of that. And despite all of that, she was still able to make something out of her life. Today, she's about 80, but she said she won't choose another life than what
Yeah.
she has because those terrible experiences shaped her. So very early in my life, I made up my mind that I wouldn't let these bad experiences of losing both parents early shape me in a negative way. If anything, I will let them shape me in a positive way. So I think that's the way that I would say helped me to remain in the faith despite.
Yeah. Since you're sharing books and you're talking about books, you titled your book "Adapt and Advance." I want us to go beyond just the fact that that's the title of your book. What does that phrase mean to you? Adapt and
Yeah.
advance.
So what it means to me is, and that's a wonderful question. What adapt and advance means to me is, when I was putting the book together, I reached into my heart of hearts right inside me. And I'm like, what is one thing that has helped me the most to navigate all these hardships, losing both parents, and many other challenges that is not even related to losing both? Like, all humans, we go
Yeah,
through challenges. And I believe
of
that is
course.
common to man, no matter
Yeah,
how rich or how poor we are. It might just be different. Everybody
yeah,
goes through things. So I reached into my heart. I'm like, what's one thing? If I'm going to summarize my life into two words as what has been most helpful to me. And that's how the inspiration for that phrase, adapt and advance, came through. Three words. Like in every situation and in every season, I have kept adapting to the situation that I'm going through, which means adapting is accepting the reality of a difficult situation. Then advancing is going forward
yeah,
despite those reality. On one hand, I could hold the reality of this is hard, this is difficult. There were times I cried. There were times I locked the door and I cried and I wept. And I'm like, God, why did this happen to me? Why must I go through all of this I'm going through growing up? Holding that one hand. And then on the second hand, I have to tell myself, Wale, you've got to wake up and move forward. You don't let all of this thing weigh you down. And for all those listening to this at home, one word I have for everybody is no matter how hard it is that whatever you are going through right now, you could still acknowledge that this is hard, this is difficult on one hand, but on the other hand, you can also still acknowledge that I can move forward and advance, which is going forward despite the pain. So
yeah,
the pain is still there, agreed, but at the same time, the success is still there. It's kind of bittersweet. Like you have the
yeah, yeah.
bitterness on one hand, on the left hand, but on the right hand, you can still press on and make significant progress to taste the sweetness of life.
Thank you so much for that advice. You're both a psychiatrist and a man of deep faith. I'm curious, how do you bridge those words in your practice?
It's for me. It's not real. Honestly, it's not so hard. I believe everything works hand in hand, and I draw a lot of inspiration from the Bible every single day and from God's word every single day, even in my practice. Of course, I don't go about telling Bible when I'm seeing my patients,
Yeah,
but they could feel. Patients can feel that inside of my heart of hearts, I want the best for them. I pray for them. I don't necessarily tell them I do that, but
yeah,
I want them to be better. I want them to be healed. I speak heart to heart beyond the medicine. Of course, I give them the best of the science in terms of medications. I give them the best in terms of therapy. Outside of that, beyond all of that, I make them realize, like there's a part of my mission statement I always tell on my patients whenever I'm discharging them. which is, be the best version of yourself. That's part of my own personal mission statement. I tell you, this is part of my own mission statement, that it's something everybody can work with in their life, to be
Yeah.
the best version of yourself, no matter what you are going through, whether you are in the pit or whether you are in the palace. Just like Joseph, the story in the Bible, the time he was in the pit, there was a time he was in the prison before he eventually got to the palace. So I always tell people, no matter where you are, whether it's in very difficult circumstances or things are better for you and you are making progress, no matter what it is, always tell yourself every single day that I want to be the best version of myself. And the best version of myself means the best I can be. So it doesn't mean that you are rich. It doesn't mean that you are poor either. But wherever you are, be the
Yeah.
best that you can be. So for me, I can bridge both faith because I live my faith. So, one thing I give everybody is a smile, whether I'm working or, I don't have to, they don't even need to know where that is coming from. But I know inside of me, inside deep, deep,
Yeah.
that the smile I carry is based on my faith in God. And the fact that I know that no matter what comes my way, the God I serve, the God I carry is more than enough to see me through. So I have a smile on my face, even when it's hard. I have a smile on my face, even when it's tough. So everybody could see that the smile is not exactly telling people this is coming from my faith,
Yeah.
but that's my faith giving a gift to every single person I encounter. Whether it's my
Yeah.
patient, whether it's my colleagues, whether everything I do, I try very hard to live, the life God would want me to live and impact people. I tell myself every morning when I wake up, I want to be the best version of myself, and I want to go to bed empty. I want to empty everything God has placed inside of me to bless myself and to bless my world. I want everything to flow out so that when I'm going to bed at night, I know I've given my best to my world. So
Yeah.
that's where I see my faith impacting. So it impacts my job when I'm doing my psychiatry job too, and to do my mental health. But one thing we do know also in psychiatry is those who have faith in something higher than them. Even if it's not necessarily being a Christian, but they hang their faith in something bigger than them.
Yeah.
They tend to do better. For example, depression. They tend to do better in depression than those who don't hang their faith on anything, because that give them hope, that
Yeah.
there's a higher being, there's a higher power. And we also know, for example, alcohol anonymous group for those who struggle with alcohol. It's one of the things they believe in, faith in a higher power more than them, to help them, to get them through. It doesn't necessarily mean that it's a Christian faith for all of them,
Yeah.
but
Yeah.
at least they believe in something bigger than them to help them and to see them through. So that's the way I practice. I believe there's a higher power. And if I have patients who would specifically say they are Christians and that helps them, then of course I could now talk to them on that level. But of course,
Yeah.
very few people in that are in that category.
So yeah, I guess in essence, it's to be a living episode, walking, living, breathing episode. You just living and being around is an episode. People just read you. You don't have to like go out of your way to necessarily talk and say, oh, this is it. But they just say, well, there's something about him. Yeah, like, oh yeah, I guess he's a Christian. That's why.
Yeah. At
Yeah.
times, the gifts we can give people is just be present and, be present, be pleasantly present so that at least your presence is not added to people's pain. But if
Yeah.
anything, your presence, the pleasantness and your warmth in your presence is helping them, to address their pain in a better way.
Yeah. Wow. Thank you so much, Dr. Oluwole. Your
Yeah, welcome.
it's a good thing that you're a man of faith and you're also a psychiatrist because this question I'm about to ask you, you're the best person to answer the question. Depression is often misunderstood, especially in faith-based communities. It's stigmatized. Um, why do you think that is, and how can we normalize having more honest, stigma-free conversations about it?
So,
Before we dive deeper, I'd love to invite you to join the Observe Day newsletter. Every week, I send you highlights of upcoming observances, creative ways to celebrate, and behind-the-scenes extras from the shows. It's the perfect way to stay inspired and never miss a meaningful moment. Sign up today at observeday.com/join. That is observeday.com/join. Now let's get back to the conversation.
in the community of faith, one thing I always tell people is it's not only depression, even for other things too. For example, I remember very early in my career as a medical doctor, before I even came into psychiatry, when I have patients come to me and they are like, they have high blood pressure and they tell me, doctor, I believe God has healed me. I don't want to take my medication. I don't argue with them. I just tell them, get a blood pressure machine and check it. If you have prayed and you check it and it's okay, then that's fine. You don't need to take meds. But if you check it and it's still high, then is either your prayer has not worked or God wants you to attack it in a different way. Or God, whatever it is, God might just be saying something you need to be sensitive to.
Yeah.
I'm not saying God does not heal people. There are people that pray and it goes away. And there are miracles. God does miracles. But we all know that we don't, even people of very great faith that God has worked big miracles through them, you know, they they cannot say exactly that this is the person that God will heal. They just say it as God has said it,
Yeah.
and God heals whoever He wants to heal. They can pray for 10 people, God can choose to heal one or two, or whatever number. So I believe in supernatural healing, and I believe God works miracles in our lives. But I also believe in science, and I also believe God gave us a brain. Like there's a book I read in about 2000 that say towards mental health, where God gave us a brain so we can give Him rest. So at times God also wants us to use our brain. And all the doctors that have gone to school and all the scientists and all those who have discovered so many things all over the years, God gave us brain. The car we drive today, God didn't drop it from heaven, right? So
Yeah.
God gave us brain to make cars. He gave us brain to make jets, to fly from Nigeria to US or wherever you want to go to. So God also gave us brain to help us to come up with medications and things that can help. So what I would say is depression has a biologic basis. And what I mean by that is, for example, some people are just more prone to it than others. It's just like blood pressure. If, for example, you have a parent who has high blood pressure, the likelihood of having it is higher than somebody whose parent did not have it. So there's
Yeah.
a biologic basis also for most mental health, schizophrenia, depression, everything. It's more common in some genetic loading for people. That said, doesn't mean that if you have parents who have it that you must have it. No, but it's more likely
Yeah.
than someone who does not have it at all in their history. So there's a biologic basis, and there are some things in the body substances. For example, we have serotonin, that it's one of the biggest substances that the medications target to help to treat depression. So all
Yeah.
of that also happen in the body. So there's a biologic basis for it, but also the best treatment for depression, for example, we say is a combination of medication and therapy. Therapy is talk, somebody talking to you, and which some people believe in Christian therapists. There are Christian therapists that can talk to you Bible way, and there are therapists that are trained to talk not necessarily in Bible ways, but there are principles that they use that cuts across board. So the best treatment, for example, for depression is medication one hand, therapy the other hand. So I would say, I think one of the reasons why maybe there's a lot of stigma around it in churches, people feel if you are hearing God's word every day, that should be enough for you to like be encouraged and, be overcome depression. It's like it's completely under your will. There's
Yeah.
some truth in it, but it's not entirely true. And it depends on the level of depression. I would say on a scale of 1 to 10, let's assume 1 to 10 depression. There's 10 over 10 depression where even the person to get out of bed is almost impossible. There's some people that
Yeah.
have depression with catatonia, like they won't even eat for days,
Oh.
they can't, like it's so bad. And there's number one depression where just maybe a word of encouragement is enough to get that person out of it. So there are, can I imagine there's a people on 1, on 2, 3, 4, 5, 6, 7, 8, 9, 10. For somebody on 1, 2, 3, 4, even 5 may not need medication. Maybe just encouragement. Maybe just reading the Bible might be enough for those people because the level of depression is not that big and is something that is easily amenable to therapy. Reading a book,
Yeah.
for example, like for me growing up, times when I felt very depressed, when I read a book, I got encouraged. I would say maybe if we just pick those numbers, maybe I'm like 1 to 5. But for people that are like 6 to 10, like they can't even get out of bed. They are not even eating for days. Some people don't eat for 5, 6 days
Oh.
because of depression. So that's beyond, you've got to intervene and do something. That's
Yes.
beyond just talking to them alone. So the church needs to understand that there are levels. And so people might need biologic help. Some people might need what we call ECT to shock them out of it, to get better. Some people might need medications to get better, but there are some people that just words of mouth is enough for if the level of depression is not that high. So people need
Yeah.
to understand that there are levels too of this disease.
Thank you so much for clarifying that. Depression is as I mentioned earlier, it has a lot of stigma around it. What are some common misconceptions you see uh, people having about depression, even among spiritual leaders, professionals too?
Yeah, I think the biggest misconception is what we just talked about. Like, it's completely under people's will. It's not completely under some people's will. There are some biologic processes going on in the body that could be overwhelming for people. So it's a misconception to think somebody who is depressed it just does not want to be happy, or is just deliberately, faking it. No. So that's number one. It's not completely under people's will, and there are biologic basis for it that make people predisposed to it. So when we see people that are really depressed, they need to be shown compassion, not to be judged.
Yeah.
So I think that's one thing that we have to note. In the spirit of love, we need to show compassion to them. We need to help them get to the clinic to see a doctor that can help them, or even to see a therapist. Like I said, not everybody needs medications. But for
Yeah.
those who do need medication, let's also get them to where they can get it. I think that's one big misconception that people have. And another misconception would just be like, for example, saying maybe reading the Bible is all you need to do and you get out of it. I'm not saying there's no power in God's word to do everything, but we all do know that at times people still need some help despite the fact that they have read the Bible. So the fact that people can even take medications and get better, it's a miracle in its own. That's the way I look
Yeah.
at it. So that the fact that we even have medications for it, it's a miracle in its own. There are some diseases that don't have medications that
Yeah.
scientists are
No,
still
they're
troubled.
nothing. Yeah.
Yes, I know for it. And there are some diseases that are technically death sentences because maybe 90% of those who have it will die. That's not the same thing with depression. The likelihood of doing well is high if they get the necessary help that they need. So it's a misconception to feel that uh, people cannot get better when they already have depression or other things. So there's healing, and medications do help. Therapists do help. Some people need just therapy alone, and some people need both medication and therapy. So those are all things that at times people misconceive. Some people feel the medications never do anything, the medication never help, and I see it all the time. And there are multiple kinds of medication. If one does not help, then we could try other forms of medication to help
Yeah.
the person. So those are common misconceptions that I've seen, especially in the community of faith.
Thank you so much for clarifying that those misconceptions. For someone who's listening, who's struggling right now, feeling like giving up, or probably even giving up, what's the first step they can take toward hope and healing?
So I would say to someone struggling with depression, you feel down, you feel, all of that. I call it a three-legged stool or a triangle. Like I've talked about medications, I've talked about therapy. There's a third one too, and which is, we call it lifestyle modification or accepting responsibility. There are a lot of things too we can do that can also help too. Help the meds, help the therapy to work well. Things like diets, eating healthy food is very important. Things like exercise. There's a lot of science that has shown that even exercising, getting up in the morning and moving around goes a long way to help people get better and overcome depression. So exercise, we have diet, we have even taking care of yourself. Sleep is very, very important. That's something that I also encourage people to pay attention to. We are in the age of social media where some people are on their phone until midnight. One thing I tell myself is sleep time is sacred. As important as my job is, so also my sleep time is sacred
Yeah,
too. Because if you don't get to rest for
you
your
can't do
body
the
to
job.
recharge, then you won't be at your best the next day. So I want people to protect your sleep the way you protect. Like, if I don't go to my job, I can be fired. It's like if I don't go to sleep, my body too can fire me. Something
Yeah,
like that.
yeah,
So I would say all of those things. Pay attention to your diet, healthy diet. Fruits and vegetables are very important. There's a lot of science that has shown that those things too can help. Exercise, move around at least 30 minutes every day. I do 10,000 steps every single day on the average, or even more than that. I would encourage people to always do something like that to help them keep moving. Is one of the ways to keep advancing. And
Yeah.
then the third one is make sure that we are doing other things, all the healthy things that can help keep us healthy. One way or the other, they also contribute to our mental health. But if you do need to talk to a therapy, I don't know, if we have that culture. So it's not so much a big culture in Nigeria, but overall, I think
Yeah.
therapy, it's a big thing here in the US. You can easily look up online and find a therapist, and that'll be covered by insurance and stuff like that. If you need to talk to somebody, I know, even if it's talking to a friend, I know most times pastors fill up into some of those roles, or other friends, or other more spiritual people. Please talk to them, and don't keep it to yourself. Don't keep it to yourself, especially when it's crossing to the realm of people having thoughts of suicide, of killing themselves. That's not something you want to keep to yourself. You want to make sure you have people you trust, people you believe in. If it's here in the user house, of course, call 911 or call whatever you have to call, so that you can get the help you need. An ambulance will come get to the hospital, and they will get you to the help that you need to get you out of whatever it is that is prison. So I would say, go get help. Do all things that you can do within your power, but at the same time, if you need more help beyond yourself, please step out and get it.
Thank you so much. Um, so far, we've been talking about the individual. I'm curious, what can loved ones, friends, well-wishers, what can we do to support, someone facing depression or emotional burnout, where we just noticed this guy who was, the life of the party. Now he's secluded. It's not like we diagnose it, but we can see signs. What can we do to support?
Biggest thing we can all do is, we all should be advocates for mental health. Instead of putting a stigma on it, what the best thing we can all do is step out, and even just being there, at times even without talking, your presence alone could speak a lot of volume to people. So let's be there for our loved ones. Let's be there for people. Let's hold their hands and, tell them it's going to be okay. It's going to be all right. And if people need to go to the hospital, then let's step out and help them get to the hospital. If people need to take their medications, let's step up and encourage them. For example, it's been shown that those who have schizophrenia, for example, that those who are married, they tend to live longer and do better than those who are single. And
Yeah.
it's not rocket science, it's common sense,
Yeah.
because they have somebody watching out for them. In mental health, in the realm of schizophrenia, for example, it's a realm where you don't see yourself again because the brain is faulty. If it's hypertension, if it's headache, if your brain is working well, you can take good decisions to help your days, your whatever part of your body. If your leg is paining you, your brain is working. You know what to do. You know where to go.
Yeah.
But for somebody who has schizophrenia, for example, because the brain is the one that is sick, it does not even know that it needs help. It's
Yeah.
people
Yeah.
around him that will know that something
Yeah.
is wrong
Something's wrong. Yeah.
with this person. They might be saying things they should not say. They might be saying things that does not make sense. They might be dressing odd. It might be hot and they are wearing layers of jackets. They might be outside laughing inappropriately, and they will be enjoying themselves. Just similar to the
Yeah.
kind of mad people we see on the streets. They don't know that anything is wrong with them. But it's family members that can tell that no, something is wrong. This is not you. This is not who you used to be. And they might
Yeah.
even be arguing that I'm okay. It's all of you that you are
Yeah.
not okay.
See, I'm okay.
So in that case, there's a whole lot for us to do. So instead of stigmatizing it, we should help get them to where they can get help. And after they get the help and they come back home, it's family members also can become, if they are excessively critical, is impossible. They should know that this is an illness, that this person is not just deliberately doing what he's doing.
Yeah.
We
They're
call
sick.
something negative symptoms of schizophrenia, which means the person, we call it evolution. The person does not want to do anything. It's not that the person does not want to go to work or he wants to be lazy. It's part of the illness. It's a symptom of the sickness that this person does not want to do anything. Or we have one we call asociality, where the person does not want to mix
To
up
talk
with
to anybody.
anybody.
Yeah.
It's all part of the illness. So if family members are too critical, then that's why you are sick. It's because you don't come out. It's because you don't talk to people. It's because you don't go to work. They are killing that person softly because it's not him, it's not her. It's the disease, is the illness in him. So what the best we can do is support. Help them take their meds, help them go for therapy, help them do everything, and whatever support we can give, to help them get out of where they are dealing with. When people hear voices that are not true, they see things that are not true, is extremely distressing. My patients, when they tell me all these things, I just can't even imagine what is going on in their head, because when you are seeing things that other people cannot see, it's hard. It's a hard life to live.
Yeah.
So we should not stigmatize them. We should not feel they don't know what they are doing. We should not feel they are doing this to themselves, which at times is true. For example, those who use drugs, drugs can cause some of those things, and they might have caused it for themselves, some, but it's not all about that. Even some people who don't use drugs come down with
Yeah.
it,
Yeah.
because of the biologic basis that they have. So we need to show more mercy as family members and as friends, and try to understand the illness so that we can best help them.
Yeah. Well, thank you so much, Dr. Wally. Where can, at the beginning of the episode, we talked about your book, Adapt and Advance. Where can listeners learn more about the work you do and also connect with you?
It's simple. So currently, the best place to get my book is on Amazon. It's listed. I have the 4 different versions. I have the hard copy, which I always have with me here, and I
Oh,
also have the soft
Adapt and
cover
Advance.
copy of Adapt and Advance. So this is how it looks like on Amazon. If you type in Adapt and
Wow.
Advance on Amazon, it's going to pull up my name. Historically, I've had people struggle to get it in Nigeria. One of my friends, they had to pay money to me, and I shipped it from here to them. But I don't know what the situation is in Nigeria now.
Yeah.
But there's the ebook that is $199, $1.99, and so that's the cheapest part of the book. And there's the audiobook too. There's the hard copy, and all of it's on Amazon. I think that's the best place to get it. My email is also in the book. If you want to reach out to me, send me a message. You should feel free to reach out to me, and I will try my best to reach out to them. And of
Oh,
course, if the book has been a blessing to you too, I would like to know. And I'll be really happy to read those emails, and you can connect with me. I also have a YouTube channel where I
wow.
speak at least, it's Oluwole Babatunde 1870, where I talk about, mainly I speak from the book every week or every other week right now. So you can find me on
Yeah.
YouTube. I'm also on Facebook too, Oluwole Babatunde. So yeah.
Yeah, well, thank you so much. I'll add the links mentioned in the description so listeners can just click and go directly to the site. It's been an
Thank
absolute
you.
delight chatting with you. I know more and I know better regarding depression.
Thank you so much. Thanks for having me.
Yeah.
I'm grateful to be here tonight.
That's it for today's episode of the Observe Day podcast. Thank you for spending your time with us as we explore today's observance. If you enjoyed this episode, be sure to subscribe wherever you listen to podcasts and share it with a friend who'd love to celebrate life special days too. Don't forget to join the newsletter at observeday.com/join for more observance stories, tips, and updates. Until next time, keep finding meaning in every day.